We are back, Rachel and me, Mara, for the April exercise. We are going to talk about the abdominal and the deepest abdominal muscle, which is the transverse abdominis, OTA. We are going to ask her to lie down on the back and to look if she needs some support for the head to heal and to bring her in the most comfortable position. And we can keep the legs straight, think about that you are starfish, and the legs, the feet, the ankles, everything relaxed, the shoulders and the neck and the head. These muscles is very hard to find him because it does not take us anywhere, does not move us. It's just a big support of the internal organs and of the body when we exercise. It's a wide belt from the right side to the left side and from the bottom of the ribs to the pelvis. We can find him when we through a deep exhalation. So I'm going to Rachel to ask her to take a deep breath, and when you breathe out, I'm watching if she can pull the abdomen in, scoop the abdomen in, or vacuum the abdomen in. And I'm going to watch her a little bit more. And in one's condition is to relax, in fact, the body. In fact, we talk about the relaxation of the superficial muscles that usually we like to tight and they clench and being pushed out. As a tool, I'm going to use a weight plate of 5 pounds, but you can use a book, Harry Potter, or anything that we can feel a little bit more to feel how to vacuum the abdominal deep inside. I'm looking if the plate is horizontal for me to be sure that she is in neutral position, the pelvis and the lumbar spine not hyperarching too much and not flattening too much. And I'm seeing if she can vacuum the plate, scooping the plate, or build up a leg for the plate. The next position will be to bend the right knee and to bend the left knee, so knee slightly bend. Also watching that the plate stay horizontal. And again, so through a deep exhalation, we check it out if she succeeds to scoop the plate deep inside. The next tool, I can use a ball, a mini stability ball, or any beach ball between the thighs, because the inner thighs and the pelvis floor, they help to activate these muscles and they create an elevation for the internal organs and as a support for the bigger superficial muscles. That's what is our goal in our fitness workout. It's very easy when you squeeze the ball to rock the pelvis. So one challenge will be how to squeeze the ball and sometimes I'm tricking them because I'm trying to take away the ball and I ask them not to let me. The next exercise will be to take the ball away, to zip the legs together and to start a little bit of motion. So I'm going to take a deep breath, exhale, breathe out and slide your right leg on the mat. We are going to inhale as you bend the right knee. And then as you engage the abdominal, then you slide your left leg. I'm going to ask Rachel to continue a few more times. Well, one of the questions that I've been asked, when shall I tighten my abdominal? And the answer is we need to first the exhale, tighten the abdominal as you exhale to encourage the breathing, the air come out of the lungs, a fraction of a second before we act, before exertion. In this way, you brace yourself, and then you prevent injuries. The next exercise will be single leg tabletop position, and you can slow down a little bit, so exhale, tight the abdominal, and then pick up your right leg. Inhale as you vacuum the plate, and then lower the right leg down. Take a deep breath, exhale, vacuum the plate, and then pick up your left leg. Take a deep breath, exhale, scoop the abdomen in as you lower the left leg. We are going to repeat one more time, so the exhale as you feel, yeah. And it looks like she's doing nothing, but in fact, if you just on and off, you squeeze the abdominal with on and off like you squeeze a sponge, you're going to see that is the best abdominal workout that you can do without any injuries and in a safe way. Alternative way is instead of the plate to use TheraBand, and this will help us also to understand more anatomical about this muscle. So we can have the belt wide and cross over the abdominal, so over the part of the body between the ribs and the pelvis, so as wide as you can. Then when we breathe, take a deep breath, exhale, breathe out, then we can cross, squeeze, and rub the waistline with the band. In this way, you feel the fibers, how they wrap the body. Brace as a corset. Thank you so much for being with us.